Antonio, what comes up now and then is people on high dose steroids for whatever reason. Could be pneumonitis, could be for a rheumatologic condition. So prolonged high dose steroids, we taper that down over time to reduce the risk of what's called adrenal insufficiency. So in anything endocrinology, when you take a high dose of something, it suppresses your body's production of its own steroids, because why work hard when you're getting it exogenous, meaning you're taking it outside the body, put it inside. So your hypothalamus pituitary axis, is what that's called, gets suppressed. So it stops telling your own adrenal gland to make cortisol. And cortisol is a stress hormone, is necessary for life. So you're talking about hormones that keep you alive today, that is one of them. So we know cortisol goes up with stress, and it being chronically elevated causes problems, but it's essential to you being alive. But what a lot of people don't understand is, as you're going down on the steroids, when you get around physiologic replacement around 20 milligrams and less, is when you're more likely to have adrenal insufficiency issues. And those symptoms could be fatigue, which is kind of ubiquitous, nausea, anhedonia, I mean kind of listless, lethargic, dizziness, low blood pressure, some electrolyte abnormalities sometimes. Doesn't necessarily, so it's important for the doctor to be aware of that. So if you become acutely ill, we give what's called stress dose steroid, usually double what you're taking to get you through that time. And a lot of people test during that time, like check your what we call ACTH level and your cortisol level. They're going to be suppressed, so there's really no point in checking. So you treat the patient, not the lab. So if they're having adrenal insufficiency, you give them steroids, and then a slow taper until they're off. And for true testing, you need to do it probably 2 or weeks longer after they completely stop steroids. Otherwise, they're going to be suppressed. And then longer than that, if it's unclear, you need to do what's called stim testing. So you give exogenous medication, helps stimulate cortisol production, and we've done that in our office many times, and that's kind of the gold standard for checking for adrenal insufficiency. So that's your pituitary adrenal gland in a nutshell. Pituitary has a lot of hormones, kind of the central processing center for all the hormones in your body. But the one that's necessary to keep you alive today, you can live without everything else, is cortisol. So if that goes, you're gonna have a rough time, but you gotta figure it out, and we can do that here.